The challenge with screening in most of our cases, so for cervical cancer, the younger you are, the more spaced out it is, and then as you get older, you can narrow the windows. So to say, for instance, that if she's asymptomatic and she's feeling nothing, she goes in for this procedure and the cervix is checked, clean. Come again after 5 years, clean. If it was God's design that she was to end up with cervical cancer at some point, every 5 years she goes through this procedure once. We see. So 10 years have gone, has been clean. In the 15th year, at the point when it is being seen, it is likely to be the very early stages for which an intervention can even be done alongside that screening. She doesn't have to be put on a list to go to theater. She doesn't need chemotherapy. She just needs something to use like ice to scrape off those very early beginnings of cervical cancer, and she's okay. So do you understand why screening is very important? You are able to capture it as it happens. So the cost for us, and all of us, and that is all of us, it doesn't spare any of us, is that we have to go beyond the cost of that inconvenience. Someone will invade our privacy to check for disease, and the cost of the procedure. Some screening procedures are cheaper than others. So cervical cancer would be among the cheapest. Breast cancer mammography is somewhat like something like an X-ray, not very expensive. Colon cancer is also is a bit invasive because we have to use a tube and we check, your colon, okay? Sometimes we have to be put to sleep so that is done. But it is worthwhile because if it is done, your next one might even be 10 years from there. The challenge that we have as Africans, including me, is that when I feel I'm okay, I do not go to hospital. I do not feel the need to ask someone, can you check if this one is there? I think it's only Pastor Talent who screens a lot. He's happy to check for things. But as Africans, sometimes it's not our common place to want to find out. Because there are those who believe if you keep checking for it, you will get it. Okay? And that's not a pleasant thing. So I think there are those things that, we should move away from. And why I say this is that it is better that you identify it much earlier than later. Later when you are stuck and all the doctor can say is that let us give you a decent death. We want to manage your pain so that you die decently. Yeah? I think those are the extremes that we must measure. And somewhere in between here, it's very intensive. Treatment can be extremely intensive that you don't want to, go that path. You would rather have undergone the inconvenience and the invasion of your privacy so that something is prevented from happening to you. I'll tell you that there's a friend of mine who noticed that when he was swallowing food, he felt like he had a lump. No pain. He just had a lump. And so he decided to get it checked. And the doctor went and said, what I'll do is that I'm glad to know that it's not disturbing you, but just allow me to take a piece of it so that we confirm what it is. And indeed, they went and checked it out, and indeed it was cancer. So he's been walking the streets, going to work. He was okay and normal, apart from this thing only hits him when he has to eat or he has to drink. Then he notices, oh, I have this lump, right? So the beauty is that when the doctor came back with the report, he said, bad news, we have cancer. Good news is that it's in the very early stages and something can be done on it. Had to go through radiotherapy, and he went through chemotherapy, and indeed the cancer was cleared. After that, he made an application to go to graduate school, do a PhD. He recently completed his PhD. It's a beautiful story of someone who got it caught in good time. So as I say this, I know we all struggle with the idea of screening, but I highly and strongly recommend that we take up that habit of screening so that we are able to avert diseases, more advanced disease that may come our way much earlier rather than later. So I hope that would, I was just taking those minutes so that I hopefully convince us all, including myself, that it is very important that we all take our time and screen for different cancers. Are we at the point where we can take questions? We have about 30 minutes, and so we are happy to take questions. Do you remember the distinction between stage and grade? Yes? Anyone? You remember? That's good. Okay, I thought that was important that we carry. So the mic is going to go around and we'll receive any questions. And I'll be referring these questions.
Happy Sabbath. Happy day. I just want to ask a question concerning the gut cancer. I know a relative who died of throat cancer. And looking back at how he lived his life, I have a question like, can dental or oral health have a predisposing factor to throat cancer or gut cancer?
Give it to Eric or Tabitha, any one of them. So I'm curious to know about your relative. The issues are, so you say something about their lifestyle.
She's confirming whether there was smoking, alcohol take, or something like that.
Right. What was it about their lifestyle? Because you say that in your question.
They never bothered so much about their oral health.
And they developed throat cancer. Okay.
I know there are quite a number of factors that lead to throat cancer, and I know in most cases we see people who take these smoked foods, people who use firewood and stuff like that. So I was trying to get that history from her, which apparently, yeah, so The other issue, the other lesions you can have in the oral cavity due to the dental hygiene and all that. But I highly doubt whether the brushing of teeth could have led to that. Yes.
Great. Great. Yeah, thank you. There's probably something behind it that, would have been responsible for the throat cancer. And it might be difficult to make a very direct association between their dental hygiene and the throat cancer. However, maybe at the time you were interacting with them and to see, oh, the dental hygiene is poor, that was the cancer itself. Which came first is a question, okay? So that the cancers of the, neck, throat, they have a very distinctive smell, right? And so for you who is a relative, you might say, hey, this guy doesn't have good hygiene, but it is disease that is making you perceive that. Does that make sense? So that it is what you would say, I don't know, when we say this causes this, it is flipped backwards. It is the disease that was causing what you were experiencing as, or what you might have been perceiving as poor oral hygiene. I hope that helps. Good. Thank you. But yes, as Tabitha says, you have to look at the other things that were exposures that may have been responsible. And then the oral complaints you are talking about are a manifestation. Right. Yes.
Happy Sabbath. I have two questions concerning cervical cancer or cancer of the cervix. Number one, Elder, maybe you can exhaust on stuffs like pap smear and via villi and pap smear. Secondly, in my line of duty, I hang around comprehensive care clinic, stroke chest clinic, and I've realized that almost all women who are on HIV medication, nowadays quite a number of them are being subjected to cervical cancer screening. Could there be a connection or a relationship between HIV and cervical cancer? Thank you.
Who wants to take that question? Edna, you are happy with that one? Edna is by the door.
So happy Sabbath. So I'll try and comment to that. So for the HIV infected individuals, we know that their immunity is low. So this in itself predisposes them to cervical cancer. And we know there's an association between human papillomavirus, HPV, and cervical cancer. So, and a higher percentage of people who are HIV exposed, HIV infected, probably, let me say probably, a higher number were infected through the sexual route. So there's that association between HPV, cervical cancer, and the immunosuppression that HIV causes in an individual. So that's the connection. That is where you'd find most of the individuals who are HIV positive, the women are, usually they are screened, not majority of them have, but there's usually a number that turns out positive. Now, for via villi and pap smear, what I have to say, they are both screening procedures for cervical cancer. For via villi, it's done from, we say 16, 15 to 49, and then for pap smear, it's done from 50 and above. So pap smear is more, there's a specimen that is collected and taken to the lab and tested for the disease. And then for via villi, if it's via, there's acetic acid that is used, and then there's one that uses Lugol's iodine, I think. And you get the results. You just apply on the cervix, and you're able to see if there's any lesion. You can get immediate treatment. It doesn't mean if you're via villi positive that you have cervical cancer, but as Dr. explained, it screens at an early. You can get it before it becomes a cancer, and then you get the various treatments that are available. So anyone else can add on that.
Francis, I hope that's clear. Yes. Indeed, just to add on to what Edna is saying, when you look at proportion of people living with HIV and people without HIV, burden of disease, cervical cancer, is higher among the group that lives with HIV. And so that is why the focus is towards aggressive screening among that risk group, right? Because the HIV modifies their risk of developing cervical cancer. So that is the connection. Yes. Delphin.
Okay, I just wanted to understand, for example, today I go for cervical cancer screening, and are there possibilities I can be given false results? For example, many a times there are people who have tested for HIV and they are given to be HIV positive, yet they are not. Is there a possibility that if I go for the test, I can come out with a result that is not appropriate?
That's a good question. But I'm worried by the questioner. So one is the question about the HIV test. So we got a chance to discuss the HIV test and how it works. And when do you say it's positive versus when is it negative? Okay? If you get a test, this is layman recommendation. If you get a test and you doubt it, Jackie, what would you do? Go for another test in a different facility, yes? Make sure that the person collecting your sample does not even resemble the guy who did your first one. Yes? Just to minimize the chance that you are going to get a wrong test, okay? So, granted, tests are not perfect. There's going to be what we refer to as false positives. There will be false negatives. To mean, there are people who you will be told they are positive, yet they are negative. And then there are those who will be told they are negative, yet they are positive. But the reassurance that we have whenever we use this test is that proportion is very tiny. So to say, if we test 1,000 people, there's one who will end up with a positive test when they should be negative. Okay? That's what they refer to, the manufacturer refers to as the sensitivity. You see, this test is 99.9% sensitive. Yeah? When it's a positive, takushika. And then you'll see that for the negatives, it is specific enough. So I would recommend, go to another test. Go to another lab. Do a similar test, and then check the two. Right? If they are both positive, then there's, you start thinking that maybe it's not a false positive. However, if it is a negative, what would you do? Again, Jacqueline, let's go. I like your reasoning. From your second lab, where will you go? Negative now.
If it's negative, you trust it.
I like, I agree. I like your reasoning. It's true. So I think, Jacqueline, the risk with that line is that indeed if the first test was positive, the disease will come at a later point and it will be problematic, right? So, Francis, is your hand up? Yes.
Maybe you can take some time and go and redo the test again.
Again?
Yeah.
And preferably, where will you do it?
A different facility from where you did the first test.
And the second one, as well as the second one?
Yes.
Makes sense. Deborah says she'll go back to the first lab. So there are just mechanisms that you can check results. And then there are things that are referred to as reference labs. Labs have levels, right? And the higher the level, the more thorough the test is. Okay? So, for instance, in this region, and I'm not intending to market any hospital, I know Aga Khan has a reference lab. Okay? So, for instance, if I had gone to Manyata, someone told me this, then I'd say, oh, I went to Manyata. Manyata was affordable. It was 1,000 shillings. But in Aga Khan, it is 2,000 shillings. Say, for the price of the correct diagnosis, I would rather go to a reference lab. Then you can die with Jacqueline's position. Okay? You see, now I have a more competent lab. I'm very sure about these results, so on. But if, so say Aga Khan tells you something different, then you say, where is another good lab? So you say, I'm going to take it to, which one, Dolphin? AAR or Avenue? You take it to another lab, and that we call a tiebreaker, one that checks, and you say, if this one is going to fall negative, then it's negative. If it falls positive, then, I need to confirm a few things. But the beauty of this is this. These decisions are not left up to us as patients, okay? So it will be the healthcare provider who is telling you, check on, this is what this result says, these are my thoughts about it, okay? So it shouldn't be up to you to, deal with how you are going to do the next set of tests to confirm it, more so if you don't trust the result that you've received. First, you come first as a patient. You must be contented with what it is that you are being told, okay? And get a place where you say it is negative or it is positive. So that's a duty that your healthcare provider has. So you have to take you through that journey of understanding a negative and a positive test and how to deal with it. And we should be comfortable enough to tell your healthcare provider, I'm not happy with this result, can we do it elsewhere? That is within your right as a patient to determine and decide, so that you are personally contented when treatment plan is being worked on. Fred Mobisa, then at the back.
I have just one question. I'm using layman's language. I've seen some guys using herbs for treating of these diseases. So what can you say about using herbs in treating some of those diseases? Herbal medicine.
Herbal medicine and treating. Eric, talk about herbs and treatment.
Thank you, Elder Mobisa, for that question. We know that herbal medicine is actually dominant in our setup. But I want to begin from the end to the beginning, that we as the healthcare workers in the hospital, we cannot recommend herbal treatment, because the way drugs are being manufactured, they get tested scientifically to know whether they can act on that disease, which we know that herbs, at times, you cannot have that reliability, what we call like the efficacy, how effective that drug is. However, I want to say this. I know there's a dispute between people who have said that herbs have worked. Well, we know that drugs come from trees, most of them, and other drugs are manufactured from chemicals that might not be necessary from plants. Like quinine. Quinine is a plant that is found somewhere, is it in India, somewhere in Asia? When it's converted, it works, it treats malaria. When I was young, in Pathfinder, we used to, in our home, we used to recite about trees and plants and diseases. I don't know whether some of you did that. That there's a drug, there's a tree that treats such kind of a disease. Like there's one tree I know, I don't know how it's called in English. In my vernacular, it's called omosocho. I don't know whether you know it. Who knows it? So when you have a fresh gund that is cut, unaenda unakata huo mti, and then there's a white fluid substance that it produces. Actually, if you apply on it, it stops the bleeding, and then the gund heals faster. So we used to apply that, it used to work. But scientifically, I cannot say the quantity, the dosage, how it works, but I know that it works. So for us, we cannot recommend that you go for herbal treatment for cancer. We can refer you to a hospital, because as medics, we cannot quantify and we cannot explain how those herbal medications can work. But if they have worked somewhere, again, we don't want to dispute, because others have said that they have worked. But for us, we cannot refer you to that. We'll always refer you to an oncologist and a specialist. Thank you.
Thank you. Philip, would you want to add anything on the...
Okay, thank you for the question. One thing that I can say is that herbal treatment is very common for cancers, and it is a cause of delay for people seeking treatment. And as you've heard today, for cancers, the earlier you go in, the better your chances of a recovery. So just be careful that you don't end up spending a lot of time on herbal treatment, while you could have gone in when your chances for treatment are still good. The other thing with herbal treatment is that it is associated with a lot of intoxication. So if you work in a hospital, the people who've worked in hospitals can tell you that at times when patients go into hospital, you have to deal with the other problem of treating the intoxication from these herbs. The herbs are actually drugs, as Elder Juma said, but they are times given in doses which are dangerous to the body. So someone comes in when the kidneys are failing. The kidneys are failing because the herb you are using has an active agent which then messes up the functions of your kidneys and such things. So those are the two risks you should look out for, that you don't delay in seeking treatment because you're on herbs, and secondly, you don't take them in doses that could cause you further health complications. But people are people. People have their beliefs, they have their cultures. You can't force someone to take what they call conventional medicine or dawa za kizungu compared to the traditional medicines. But cancer is a serious thing, and the earlier you catch it, the better. Those are, I think, the comments that I may have. But at times, even these herbs that you are given are maybe you are given the herb, but you are not told the reason why you are given that herb. Maybe you are given that herb for nutritional reasons as a supplement to help you. Maybe you are losing weight. They tell you if you use this herb, it has good supplements which will help you. I won't dispute that, but it is not treating the primary problem of cancer you have. So also look for the reason you are using that herb. Some are harmless, some are good, but don't assume that it is treating the cancer. It may be helping you gain weight, supplementing something you are deficient in, and don't confuse that with the treatment for cancer. Thank you.
Thank you. I hope that's clear. I want to come to my father, Elder Yenga, but before he speaks, I just want to say that indeed the biggest challenge, as Eric has said, is in the dosing. We never know. As Philip says, two organs that are likely to go down fast when you do herbal medication which is not titrated to a right dose is one, your liver. Your liver is what breaks down any toxins in your body so that your body can handle toxins. So that's the first one that goes. And then secondly, your kidneys, because your kidneys is the system that is used to get rid of all toxins. We've had patients who ordinarily would have done very well, but because they said, this particular disease, I know the drug for it, and they start taking some medication of unexplained dose, it ends up causing a lot of injury to their system. I want to say this, and I'll be asking a question as you ask your question. The reason I want to make reference to him is because of his age. That herbal medication was not given to anyone. Or rather, the practice of herbal medicine was not left to everyone in the community. I hope that's an accurate statement. Like, you would not just walk in the village and anyone can tell you, now take these herbs, boil them, and you'll be okay. It was a science, and it used to go through families, right? So that in the village, it would be known that it is in the home of so-and-so who you are going to get treatment. Whatever name you used it. And in Luo, there are very different variants of those names. For a Juoga, medicine men, those kind of things. But it was a science that was cultivated and passed on. The problem with our generation right now is that there are all of us in between who might think we know. And so it's not working in the same way that it did. I want to tell you that I was struck by the fact that there's a time when a neurosurgeon visited a traditional doctor to see what it is that he's doing. I don't know whether he even told him I'm a neurosurgeon, but he was very curious to understand deep down, still in the remote areas, you still have people bleeding into their brains. How do you deal with it? Because they don't come to the hospitals. And he spent time with them. And this gentleman had a way of cutting through people's skulls, draining out the blood, and putting in a calabash. Right? And covering it. And these individuals ended up much better. Their quality of life isn't really great because they still have a spot on their head that is soft and you can feel a calabash inside there, but they're living. Okay? So there's that place of that traditional practice of medicine. It's only that my sense is that it was more specialized than what we have currently. And not everyone is an expert. Have you seen a Maasai walking around with a container of dark brown material? When he's dosing that thing, how accurate do you think his dosing is? But he's only carrying one of them. So whether your disease is malaria, whether this one is cholera, all of you will get this thing, right? So those are some of the areas that are a bit shaky about our current traditional medicine. So Father, you'll describe your recollection with the science of traditional medicine as you make your comment or you ask. Yes.
I just want to make my comment. You know, it's technology which is not here. Not that herbal medicine is bad, but the technology is not here. What I was in India, I stayed there for some time, about 6 years. I could walk into a herbal medicine. It's quantified like the ordinary one. It's quantified like an ordinary. You are given pills with the quantity that can cure that disease is placed there. And you are told how many taps you are supposed to take. So I think it is the technology which is not here. Even in China, it is there. Eh? The thing is, it is very unprofessional to go to a person who knows nothing and cannot quantify those things and make them like the conventional medicine. But I know my brother was operated in the head traditionally. Here in the head, and they took not only my brother, so many in Kisi. They were operated here, and the operation they take there are some layers of small, I don't know, bones. Wanatoa pole. Then they reach a point where they find there is nothing now, which is injurious. Then they bring an herb which prevents the blood going inside the brain and sucks it out. those people I know one of the old man operated and they lived 112 years. I know one man. So it is okay. It is only after experimentation and approve, when you prove that this thing is working. Otherwise, if you go to the medicine man, you are taking a risk. But if there is practical examples, verifiable, like that one of the head, in fact, I'm framing the cases for abandoning that method because it is working. People are alive. Are alive. And when I was in India, I could go to how do you call them? You what? Vedic medicine. They quantify everything. In China, the same. So the problem is ours, we have not standardized. That is the problem. And that is why we are advising people not to seek medical intervention. Because they are not even racist, they are not accountable. That is the problem. That is the problem. So that is the way I can say, the way they are saying is correct, but herbal medicine is also treating. And there are some people who have gone to universities and they are practicing herbal medicine.
Great. Thank you. Two last comments? Oh, the gentleman in a checked shirt at the back, sorry. He was first, then you'll bring to Richard and Tom. Yes.
Thank you, Elder. Mine is, I just want to deviate from what you are talking about and get this into breast cancer in men, because I think the time is not going to allow me to ask you this question. Sometime back I was reading a paper that in the US, the FDA, the Food, Drug and Drug Administration, actually they did regulate soy products like tofu. And when I came to do another podcast, they were saying that it was regulated because soy contains isoflavones, and isoflavone is a type of phytoestrogen. Let me break this down to those who don't know. These are phytoestrogen is a compound in plants, and it is structurally similar to estrogen. It's a female hormone. So when taken by men, okay, estrogen hormone is what is responsible for the features we see in women. And when taken by men, we get to have breasts, bigger breasts. Now, Adventists, we do soy too much. It is one of the beverages we can actually use, yeah, to substitute the other ones we are using. So, is it a menace to breast cancer as at now? That's my question, Elder.
Thank you. I have not come across any evidence to suggest that. So phytoestrogen, whatever quantity it is that is in soya, our concern then should be not strictly not the soya itself, but the amount of soya that you use, right? So you don't want to be drinking soya milk and eating soya bread and having soya ugali and, I know there's been a lot of innovation around how to make soya, appealing. But the point to your question that I can think of is temperance. Having a reasonable level of intake. Even the best thing that you may think about that God has created, even water, if you take it too much, it can kill you. Okay? Second concern around whether you should be worried about estrogen, and I don't know, how I got the question is your concern is about feminization of men because they are taking in estrogen. Did I get that right? Good. So it shouldn't be a concern. The male body also produces estrogen. And it's just that the amount is very little as compared to females. So your body is not a foreigner to estrogen, as you may imagine. It's just that it's really prominent, and we know estrogen and progesterone are major hormones among females, but males also have estrogen produced in their bodies. So it shouldn't really worry you. I would say go for soya if it is in your heart and you like it, but take it in moderation. Just take it in moderation. You should be fine. Thank you. Richard and Tom. Then we
Happy
close.
Sabbath. Let me start by saying thank you for the messages you have heard from morning. May God bless you together even with the Health Council. You have talked of herbal, and I can see people have been skirting the issue of herbal. We know the other herbal, and that's what I want to talk about. Particularly, I've had an experience where a colleague lost the father, and they were so adamant that it is because they took him to hospital. That's why he died, and they had started on quote-unquote herbal. Mnajua hizi situation yenye wanakuambia iwe aiwekwe na sindani. You know those things. So, probably you'll have a comment on that, but it's important to let people know about that. Then secondly, something that I want you also to speak to is the role of faith in treatment of cancer. Thank you.
Thank you so much, Elder, for the wonderful presentation. Allow me go back a bit to the issue of herbal and conventional medicine. There is a problem that I think we can advise our friends who are right here, because we may be having relatives with this kind of a disease. Some people mix these treatments. Personally, I've gone to see people in their homes. You meet a witch doctor. Amemaliza yake, alafu wewe pia unaingia. The body is
one.
The body is one, liver is one, kidney, two. So sometimes I tell them, if you have chosen to go the witch doctor way, because there are people who are testifying that those witch doctors are actually helping them. please just go the witch doctor way.
Make
if
a
it is the
decision,
hospital way, go the hospital way. But if you mix the two, this patient will have problems. We had a child who died in our facility. They were given kienyeji medicine. They were suspecting malaria. And we were talking about quantification. There is no quantity of that kienyeji medication that you're talking about. So we also give our tesunet or AL or whichever that they will decide. So you have overdosed the child. So they come to testify after the child has died. No, we are sorry, we took the child. Now it's too late. So I think it was worth mentioning. The next item, and the second last one, you talked about environment in the morning, and it really touched me. Because I used to live in Migori, it was a bit cold. Kisumu is so hot to us that at night, we don't even cover ourselves. Can we refuse to accept some transfers which are leading us to hotter areas? For example, hotter environments. Then the last thing, I want to believe that members may be having patients here. Maybe at home, we may not know. Would you kindly tell them on how to support them, the patients now? I think we are more prevention and so forth. Would you just take even a minute to teach members or to sensitize on how to handle these friends? They are always in too much pain. In fact, you will see men crying. At the moment, I'm seeing one at home. Men cry because of cancer. Is there any role of the family apart from the ones that the doctors are doing? Thank you.
Thank you. Those are really, really good questions and very well put. So we can, Eric, do you want to take some of this? They are really important questions. Then we'll pray.
Thank you. I think Elder Tom, you began from faith in the treatment, and the other question was, other than faith, for Elder Tom.
Herbal medicine.
Oh, the other angle of, the other angle of, it seems that this herbal medicine has taken root and is deeply rooted. You see, still our point remains as it was, that we cannot quantify herbal medicine. But we have to explain to the society to know why they need to seek treatment first in the hospital before they go to these other places. I know even in our modern, even where I come from, kuna kitu inaitwa obosaro. Once they have harvested beans, they burn that stock. Then inawekwa hivi, when you have an abdominal complaint, inaumwa na tumbo, such kind, just lick. You can be given even the entire house that lick. This is good for your digestion. And the people believe that it does what? It works. So when someone tells you that you cannot take an injection because it is what has killed our people, that our people, they were being mishandled by medications, scientific modern treatment versus herbal medication, I think it's about educating the community. People need to be educated. In that case, you need a doctor, you need a healthcare worker to come and talk to them. You can involve other key stakeholders, even talk to the chief and another person. By the way, if you are rightfully denied treatment by your parent, the government has power to give what rightfully belongs to that person, unless you are above 18 years and you can make your own decision. I don't want to comment about faith, but we know that Luke 1:37 says that there's nothing impossible before God. If God says that you can be cancer-free, it will not take even a microsecond. In a blink of an eye, you will be what? You will be free. And one thing that gives me hope is that if God comes today, this, as Elder James is standing at the pulpit, kufumba na kufumbua, hakuna mtu wa cancer, hakuna mtu wa HIV, hakuna mtu wa diabetes. If you are holy and you be living a righteous life, will you be having cancer in heaven? No, no such a thing. But you have to do your part. As the Bible says that seek and you will be given knock. So the seeking is that you have to go for treatment. You have to take the right diet. You have to do preventive measures. And then God in his own wisdom, he can say that now you can be a survivor of cancer depending on how that decision will be made. And that can be in a case where it's like what Elder James was saying, like it's a palliative care, what human beings cannot do. It has reached a level where you have been told that now you need to live well, eat well, manage your pain, as maybe we pray for when your days will come. At that point, still God can intervene and say, no. Elder Okoth, I don't think whether you can say that you cannot be transferred from Migori to Kisumu because Migori is cold and Kisumu is hot, unless you have a very serious health issues like asthma that is normally worsened by cold environments. And for information, actually, Migori in Kenya is known as one of the, I hope I'm not online, it's one of the counties in Kenya where tobacco is grown more. I don't know whether you're aware about that. So when you live in Migori, you're even at risk of, and remember tobacco has over 41 carcinogenic substances, over 40. Actually, tobacco ukionyeshwa vile, how many of you have gone to the hospital wameona picha ya mtu amechorwa kutoka juu mpaka mguu anakaa like how many of you have gone to the hospital? Yeah, so tobacco has a number of carcinogenic substances, over 40 of them, that can cause cancer. You can imagine sometimes you only need one, but tobacco has over 40. So as Elijah James was saying, it's one of the most terrible. And you know, sometimes there are also secondary smokers of that tobacco. Now, Peter Mali, watu wako wanatembea, wana nini, and you're also inhaling that. So, to me, I would not advise that you can say no in such transfers. First, do risk assessment. Where you are can also be a risk. But again, there are ways of managing such environments. If Kisumu is hot, it's even good for you. But if Migori is cold, you can still wear heavy clothing so that you get to protect yourself. So it is something continuous, and we still remain that we cannot advocate for herbal medication. But however, if it works, if it has worked for you, you can still call in. I think research is being done. Elder James is a scientist. And in research, you don't dispute. You go and prove. So you can come with the hypothesis that this has worked. And then you can be asked to prove. But as it stands, we go for conventional medicine unless advised otherwise. Thank you.
Thank you. Tom, a really great question. I think Edna wants the microphone. Your question is great. The Bible says, I lay before you today life and choose ye. Okay? And then further on in Revelation, it talks about the Laodicean condition. The Bible says, I would rather you are either hot or cold. And I agree totally with what Richard is saying, that if you choose to go herbal, please go with it. If you want the witch doctor, head on, mpaka mwisho. Yes? Because that is it. You know, there's a friend who sneaked a glass of herbal medication to a dear relative of theirs. After they've said, kila siku tunakuja kukuvisit, you don't seem to be improving, right? They said, now let's go to the washroom. It was a private clinic. There's a private ward. So you sneak them in and say, drink this one, drink this one. And so he drinks it, and he gets better, right? Following day. Was it the herbal medication? Yeah? Or was it the medication he'd been receiving, through the treatment. The person who brought the herbal medication left convinced that you see what I did? You see what I did? Okay? So I think we have to make a decision around which way we want to go. Choose one, go with it. And in it you will find your answers. But indeed the concern with mixing approaches, as Philip had said, is the delay that presents. Because you get to a point where the guy who is supplying you with the herbal medication now says, now this one you need to take to hospital. Okay? Then you are stuck with the conventional medicine. But in making our choices and our decisions, may God lead us. May God bless us. Edna, you have something to say before?
Yes, it was just a comment, or rather, I'd request you just say something small about childhood cancers. I know we've dwelt so much on cancers, most likely in the adults, and I know there are those amongst us who do not know that even children do get cancers.
Right.
Thank you.
Great. I was told someone wanted to talk about that briefly.
Tabitha, I think.
Tabitha. If she steps in, we'll give her a chance because she's the expert on that. I don't want to touch things that are for others. Wycliffe.
Yes, as we are still looking for Tabi wherever she is, men are a little bit silent. Men, how are you? Elder James, these fellas lately have struggled with prostate cancer. But we are struggling how to ask the question. And we would really wish to be educated about prostate cancer, and for the sake of mixed multitude, I am careful not to use these words, Guinea activity. Let me just put it that way now that you are able to understand. So, if you may, maybe a little, but you know we can retreat to our WhatsApp wall. And you do it so elaborately and so satisfactorily and more convincingly so that friends here may have, or rather may stand well guided. Thank you so much.
Good. Prostate cancer, sorry for not touching on that one. But it doesn't take too much airtime is because prostate cancer is not a leading cause of death. When you're looking at cancers and what will kill you, prostate cancer ranks very low. The extent that my professor used to say, if you come and screen me and tell me, oh, I'm worried you're very high with, this indication of prostate cancer, he said he would not act on it in any way because there was a push at that time in public health to move to what we call prostate-specific antigen in screening for prostate cancer. And so we have all levels that, we used to say high risk of having prostate cancer. But my teacher used to think that, it will not change how I behave. Why? Because in his mind he used to say that something else will kill me before prostate cancer kills me. I think you get that point. He's saying that prostate cancer is such a benign cancer that by the time that it takes you down, you will have been hit by a car, malaria will have caught up with you, something else will have just intervened and killed you before prostate cancer. And I'm not downplaying prostate cancer, And it is good to check it up. So we say you do this blood test and it tells you your level of PSA, but I think the good news behind prostate cancer is that it is not a very aggressive cancer. Two, I think, was about sexual activity. Did I get the hint right? And an association to prostate cancer, not that I'm aware of. So we have cervical cancer related to sexual activity. So those who start sexual activity much earlier in life, have multiple partners, are more likely to get human papillomavirus, the virus Edna was talking about, and that is likely to cause cervical cancer. In the men, what would be the equivalent? It is not prostate cancer. It is penile cancer. Different cancer, okay? So they go to attack the epithelial lining around the genitalia. And so that's why the converse of cervical cancer is not prostate cancer. It's actually penile cancer. I hope that answers that question somewhat. And of course, we can have other discussions in the forums that Wycliffe has talked about. Tabby, you are closing for us. You are talking about childhood cancers. Edna, that was the assignment. Okay.
Okay, how many of us here are above 40 years? I don't want you to raise your hand because age is very sensitive. When we are young, you don't want to be added even a single year. But when you are old, if someone takes away even your one day, it's a crime. So we like age more when you are older, but you hate it. So any man above 40 years, it's recommended that you go for annual screening for prostate cancer. Actually, the test is affordable. I don't think that it's above 500 shillings. The PCA that James has said. It's a blood test to check whether that hormone that indicates whether you have any chance of prostate cancer is there. So any man who is above 40 years, I know you know yourself, I think after this, make an effort of going for screening for I know there are other invasive procedures, but there's the simplest one that begins with what? With blood. And I recently attended a CME about about prostate cancer. I think that question, what the last one that James has answered, men asked that question several times. And that consultant decided to shut us down. And this is how he shut us down. That if you remain faithful with your wife only, I know men you understand what we mean, frequently, then you are likely to reduce the chance of prostate cancer, but that is not how to prevent it. But if you have other partners, many of them, you're increasing chances of getting prostate cancer. He didn't explain further. That's how he shut us down, and then he told us that don't ask me any question further than that. So I also want to state at that point that stick to your partner, and then God in his wisdom will reduce it. But if you move outside what God has recommended, you're increasing chances in whichever way that goes. Thank you.
I think I get the second dimension of what he was talking now that you said what you have just said.
Good evening, church. Yeah, I'm going to be very brief on childhood cancers. Same as adults, children can also get cancers. But when we look at what leads to cancer in children, mostly it's very different from the adult cancers. In children, mostly we'll find like genetic issues, the alteration of genes. And most of these cancers in children, we find that these babies come to us when it's quite late, or there are some who will come just for normal checkup, the routine checkups, and then on further investigations, we get they have cancers. So the common cancers in children are leukemia, which I'm sure every one of us knows, cancer of blood. We have lymphomas of the lymphatic system. We have things like nephroblastoma. This is cancer of the kidneys. We have cancers of soft tissues and bones, the sarcomas, that is of the bone, osteosarcoma, and soft tissues, something we call like rhabdomyosarcoma. We have neuroblastomas, brain tumors, tumors of colon, the colorectal tumors. We rarely get them in children. We'll get them from children of 14 years and above, but below that, we rarely get it. So for babies, what I'd like to say is prognosis is good. Prognosis in treatment of these childhood cancers is quite good. We get like 80% and above survival rates. That is the beauty with childhood cancers. The prognosis is very good. But the problem with, should I say, the third world countries is the prognosis, the survival rate is a bit low, lower than 80% because of the chemo drugs. At times you find like you have these drugs, you don't have others, so that one is also an issue. But generally, childhood cancers, the childhood cancers prognosis in such is very good compared to, should I say, adults? Yes. Yeah, so as adults, children can also get cancers, yes. I don't know whether there's anything else you'd like me to add?
I think, Edna, that was it. Okay. Thank you. Sorry for going overboard again this afternoon, but I pray that we have learned things. We have benefited from this health emphasis Sabbath. The third letter of John, Bible says, third letter of John, verse 2 says, "Beloved, I pray that you may prosper in all things and be in health, just as you are prosperous." God wishes us good health, and that's why he gives us this information, that we may lead healthy lives. If disease befalls us, do not blame. Take caution, of course, but it shouldn't be a point of blaming ourselves or blaming whoever has fallen sick. To answer to Richard's question, our role in supporting those who are sick and the place of faith when we are dealing with issues and matters of health and the outcomes, that our psychological state, the psychological state of our mind plays a huge part in response to treatment. So that it is in the patient's interest that we create an environment that boosts their psychology in terms of getting better. Patients who say that I'm not going to get well, indeed, sometimes they do not get well because of their mindset. And so it's a huge part that we have to play in terms of supporting each other. I want to thank you all for attending, for your patience and your participation in this. And I pray that God richly blesses you. Would we finish with Song 75, first stanza and chorus? And Then we can mention a prayer before we get further directions. Let's all rise with Song 75. Matthew, lead us in that song. First stanza and chorus only. 7-5.
There's a wonder of sunset at evening. There's a wonder of sunset at evening. 3 sing. There's a wonder of sunset at evening. The wonder of sunrise I see, but the wonder of wonders that thrills my soul is the wonder that Rose loves me. Oh, the wonder of it all, the wonder of it all, just to think that God loves me. Oh, the wonder of it all, the wonder of it all, just to think that God loves me.
Indeed, our precious Father, you love us. You brought us to this point that we should be able to learn from each other and to lead our lives better. Father, we are praying that in a world that is rapidly evolving, grant us grace and courage and protect us from the harms that surround us. Keep us in good health that you may be glorified through us. And Father, as we disperse through this Sabbath, we want to thank you for you've revealed yourself and you've showed us your mighty power through the story of 4 lepers. And dear Lord, as we reflect that you are a God who is bigger than our problems, may we take comfort in knowing that we have been with you today. Whatever it is that we present to you, you're going to answer it, that your name may be glorified. Put your servants into your able hands as they leave this church. May your blessings accompany them. Keep them safe and bring them back safely, is our prayer in Jesus' name. Amen.
Good evening. That has been very, very powerful. I'm sure we have all learned. I want to thank us all for being patient. I'm sure we have learned so much. I think I need to invite Lajuma to pass a word of gratitude, then pray to disperse us. This being Health Emphasis Sabbath.
Thank you. Theophilus, let me call the leaders of the department, Okoth and Edna. This is the last departmental Sabbath that we have for the year. Next Sabbath will be Holy Communion. I know the next Sabbath might be free. So you can come and say a word of thanks, and then we pray. You have a privilege. We normally begin with health and close with health because you cannot serve God if you are not alive. So,
Happy Sabbath. Happy day. I'd like to thank the speaker this day, Elder Yeko, for such an interactive session this afternoon and a very interesting sermon in the morning. And I'd like to thank each and every one of you. I know we've learnt a lot. Questions about cancer have been there from last year, and at least as we were closing this year, we planned that at least let our concerns be addressed. So I'd like to thank each and every one of you that has been here this afternoon, and I hope that whatever messages we've been able to get are going to have an impact in our lives. My assistant, Elder Brother Richard Okoth, has just left, so I know he's been on the forefront most of the times because he's the elder in charge of health. May God bless you.
Thank you so much. As we close the year, I also want to thank Elder James so much for taking us through.